Our next speaker is Rachel Pryor, who is Counselor for Health Policy for the Secretary of Health and Human Services, where she oversees Medicaid, CHIP, and substance abuse and mental health services programs. Ms. Pryor was previously the Deputy Director of Virginia Medicaid, and she has over a decade of experience on Capitol Hill and in the executive branch working on healthcare policy. Ms. Pryor, welcome to today's session, and thank you for sharing information about the Biden-Harris mental health strategy and the National Mental Health Score.
Thank you so much for having me. I greatly appreciate being here, and I'm going to have to ask for your patience. I was so excited to speak with you all today, and this is an incredible group of individuals that we have here on the line. I am losing my voice, so I am going to speak up and speak out as much as I possibly can. This is a topic of huge importance, and it's really an honor and a privilege to have the opportunity to speak with you all. I do believe, and I think a lot of us that are here from the federal government believe this, that we are at a very special moment in time. And it's a moment where I think our strong hope in the Biden-Harris administration is that we can stand together and do something real, candidly, for the millions of folks that are out there now more than ever with COVID, suffering without access to the support they need for their mental health and wellness. And nowhere, candidly, is this more evident with our birthing parents and our new parents. Being a parent, and I am one, it is a time of great joy. It is also a time of great stress, from pregnancy to postpartum. And we have got to do a better job as a country of supporting our moms and getting them access to the services that they need. And I think, this session will talk about some of that. But what I want to talk with you about is how I'm hopeful that we can move the ball forward via the president's strategy. As folks know, President Biden in the State of the Union announced a three-pronged strategy, connecting folks to the care they need, creating and building the full continuum, integrating the full continuum into our communities and into healthcare, and building the capacity of our workforce with the workforce we have and the workforce that we need to develop. All of those three prongs are critical to coverage of the services that new parents need when they're struggling both pre-birth and postpartum. Secretary Becerra is uniquely passionate about this issue. I will say he has picked up this initiative with a vengeance. He is currently traveling around our country. He's announced a nationwide mental health tour. Many of our HHS leaders are joining him on that tour, including our next speaker, Administrator of the Health Resources and Services Administration, Carol Johnson. And so we are very excited to hit the ground running, to be on the ground, hearing what we need to do. In HHS, when Secretary Becerra came in, two of his big priorities out of the 5 that he set forth for the department were behavioral health and maternal health. So that fits pretty nicely into what we're talking about here today. I want to ask for the folks on the line that are listening to our session, I want to put a call out to you that if you have something you do believe that we should be aware of, if you have a model or an initiative we should see. Everywhere we go, Secretary Becerra is focusing on mental health. Even if he's going out on a trip for something else, he wants to focus on mental health. So please be in touch with our team. It's really an opportunity for us to learn from you and you to hear more about what we are trying to accomplish. We got to keep the drumbeat going, keep the echo going here so that we can create some real change on Capitol Hill. We are very excited with what's come out of the Energy and Commerce Committee. We need to keep things moving. So we are asking for your help, your support. We're hoping to learn from you. We're hoping to advance the ball. I think folks know that our parents have waited far too long for this moment. And we are hopeful to leverage this moment for all that we can. So thank you again for having me, Adrian. I'm going to turn it back over to you. I hope that people could understand my voice, and really appreciative of the opportunity to be here with you all today. Thank you so much.
Oh, thank you, Rachel. We're so glad that you were able to join us. I know you haven't been feeling well. We really appreciate your showing up today. And we'd love to share information about how people can get in touch with your office or with your staff if they have models that they'd like to share. So if you can send that information to us, we will make sure to send it out in follow-up emails.
Absolutely.
Awesome. Thank you so much. Really wonderful to have you with us.